Capstone College of Nursing at UA. I'm a registered nurse by trade. I'm a certified health and life coach. I've got to update this slide. I'm actually going to be a new Wellbeing ambassador this year for nursing. I was a former Wellbeing ambassador for the Honors College where I taught for 10 years. And I'm one of your wellness class educators. So you're welcome to reach out to me at abby.horton at ua.edu for questions, comments, feedback, or if you just need some resources or just want to say hello. I'm happy to make those connections with you guys. So we're going to talk about caregiving fatigue. We're going to talk about age-related health concerns, age-related stress. I did update these slides yesterday because I wanted to add in some different aspects of caregiving. I have been a caregiver multiple times in my life, and I see caregiving and nursing as very different, and we'll talk about that. But I also added some things about children because you can be a caregiver even while you're parenting a child. You can still have a caregiving role. And that was always difficult for me to differentiate because as a nurse and as a mom and as an educator, those are very distinct roles that overlap. But there's also a caregiving aspect to parenting if you have a child with medical needs, which I do. And so, because that's so a part of who I am as a mother, I sometimes forget that that's very separate from my role as a mother. So, we're going to talk a little bit about that as well. So, we're going to talk about how to plan, prepare, and care for age related challenges, understand common health concerns as we age, explore healthy aging strategies. So, things that we could actually embrace as we age. I keep telling everyone I am 39 and a half this summer. I don't want to say I'm almost 40 yet, but I am. And aging well has never been more of a priority, I think, as a society, but then for me personally, too, I'm thinking about that. Because really what we're doing right now in our 30s and 40s is really preparing us for how we're going to age well. Discuss the role of caregiving and provide some caregiving support strategies and really embrace longevity and wellness across the lifespan. So we'll talk more about that. So my personal story with caregiving, I cared for my mom after she had a heart attack. So we call that an MI in nursing. And so she's had two heart attacks, two MIs. And I was very young with her first one. This was in 2006, and I was in my early 20s. And that was a very difficult experience for me. My parents are in their mid 70s. So my parents are typically about 10 years older than my peer group. And so I'm always about 10 years ahead of the curve in terms of what I'm experiencing versus what my friends are experiencing. And so that has really taught me it's so important to have a group of people who understand the kind of age and stage of life that you're in. Because if I reach out to my friends, their kids are typically younger, 5 to 10 years younger, because I had kids in my early 20s, and their parents are usually 5 to 10 years younger than my parents. And so when I have to reach out for support or when I want to reach out for support, I have to be very particular about who I reach out to because if I just call up someone who's in my age group, they may not really understand. They may not be parenting teenagers while also caring for their parents who are aging and having health problems. My mom just recently was hospitalized again for continuation of heart issues. My dad recently has had his own heart attack, has had his own heart issues, has had throat cancer. Um, because of environmental concerns, there was no really like known reason for it, but he worked in the coal mines for most of my life and ended up with throat cancer, even though the kind of throat cancer he had is typically seen in people who use tobacco or smoke or vape or things like that. And he never had a history of that, but he had a lot of environmental exposures being underground in the coal mines for most of his adult life. And so I share that because I can teach you about this from a textbook, but I think it's so much more impactful and powerful and meaningful when you can teach from real experience. So I'll give you some practical things throughout. I will tell you, I always have too many slides, but I have way too many slides today. So I'm going to talk as quickly as I can to kind of get through everything. But always happy to continue the conversation offline as well. So aging doesn't mean that you're going to automatically have declining health or a disability. And I think that is something that we think, okay, well, because I'm this age, it's common to have joint pain, or it's common to have back pain, or it's common to not sleep well. But it doesn't have to mean that. We have a lot of myths around aging. These are just my three favorites to highlight. Dementia or memory loss is an inevitable part of aging. So we kind of think, oh, well, because I'm aging, of course I'm having these memory issues. That's expected. Well, that's a myth. You don't have to have memory loss or dementia just because you're aging. And then you can't teach an old dog new tricks. This is one my dad likes to use with me when I tell him, have you thought about doing this? He's like, no, no, that's too late in life for me to do that. And it's like, no, you really can still learn. As long as you're breathing, as long as you're alive, you've got a pulse, then you're here for a purpose and you can still change. It's never too late. But you have to have a growth mindset around that, and a lot of people don't at any age. So, some facts about aging. Life expectancy for Americans until COVID had been longer than ever before. After COVID, the life expectancy has dropped by a couple of years. So, on average in Alabama, and y'all brace yourselves because we talk about this all the time as nurses, but this may not be something that is, it's definitely not something you would think about talking about at lunch, and it may hit close to home, but it does for me. 78, around 78, 76 to 78, depending on male or female in Alabama, is the life expectancy today. So if you're female, you can usually plan on living an average of 78 years in Alabama. For 76 is for men. And so my parents are getting scarily close to those ages, and that can be really jarring. So you just want to know that though, because it's important to understand as you're approaching those ages. After you get to the age of 60, 65, when you start having things like falls or you start having health issues, it gets harder and harder based on research we know to come back from those things, to come back from those long illnesses, to come back from those falls. Mostly because of lifestyle. It's not inevitable, it's not genetic, but it's because we don't have a lifestyle and we don't have an environment and support system to actually age well. And so that's where we're going to give you some hopefully good foundations today to build the environment, to build the lifestyle habits where you can age well and you can help those who are um, in your life that are struggling. My mom is going to be 74 this year, and she gave up caffeine. And as she gave up caffeine, that was causing such an issue with her heart that now she has been able to get off a heart medication. So what looked like a heart attack, she's still on a Holter monitor to monitor her heart. But because she was inspired to get healthy after learning everything that I've, taught her and talked to her about, she said, well, I think I'm finally going to give up Dr. Pepper. So she gave up Dr. Pepper. She was a nurse too, but she never drank coffee. That's kind of odd. Usually nurses, you don't make it through nursing school without learning to love coffee, but she never did. And so she wasn't getting a source of caffeine. Well, without that caffeine, a medication that she had been on for 18 years for her heart was no longer necessary. Which is wild. It's wild that caffeine was causing that much of an issue because she didn't drink Dr. Pepper that often. And so what looks like a heart attack, and she was having low heart tone and what we call bradycardia, she actually went thinking she was having a heart attack, and it was that she wasn't having enough caffeine to stimulate her, and she no longer needed the medication because it was interacting. So with her cardiologist approval, they DC'd or discontinued that medication, and that is so, so wild. So even at 74, your body can still respond. Even at 74, you can still have a growth mindset and say, you know what, I've always done this, but let me try something new. And so that was within the last 2 weeks. And I think it's important to give those kinds of stories because you don't hear about 74-year-olds getting off medications. For me, I was able to get off hydrochlorothiazide, a blood pressure medication. After 4 years of working really hard on my stress and on my diet and lifestyle and losing weight, I was able to wean off that. I tell that story a lot because you don't hear of those stories. You don't hear of those success stories. Usually, once you start those kind of medications, you're on them for life. And so, the things about aging is that you have to understand that aging well takes a lot of intention and a lot of time, and it can be challenging. It's sometimes like a full-time job. But you can do it if it's important to you. So once you reach age 65, the CDC data suggests that you'll live on average 19.3 years longer. And so for many people who are living in senior living facilities, assisted living facilities, managing chronic health conditions really becomes their full-time job. And so while we did see a dip in life expectancy after COVID, if everything continues to trend the way it is, we'll probably level back out to where we were post or pre-COVID numbers. So just kind of have that in mind. Physiological changes occur that are a natural part of aging. Our hormones change, usually beginning in our 30s, but we don't really notice until our early to mid 40s. We tend to actually have hormonal changes earlier than other countries around the world. Even, thinking about industrialized nations, with all of that being kind of equal, we end up having some of the earliest hormonal changes, both in puberty and in midlife, than any other country, whether they have a lot of resources or not, whether they have a high GDP or not. And so, what that tells us is there's something unique about America, something unique about our lifestyle and culture that we're doing that's causing these earlier onsets. It's probably the foods we eat. It's likely the stress and our work culture that certainly can play a factor. And so it's important for us to understand that we are not the norm when it comes to aging with those hormonal changes. So some diseases and conditions become more prominent. Obviously, we get more wear and tear on our bodies. It gets harder to recover. Our psychosocial needs might change, especially as we approach retirement. A lot of people, and this is backed by statistics, a lot of people will have poor health outcomes and may even die soon after retiring within the first 1 to 3 years, because sometimes people will lose their sense of purpose and their meaning. Volunteering has been shown in recent research. So, volunteering for a committee, volunteering for a community event, something where you're regularly engaging in the community at any stage of life. They're saying that that's the new elixir for longevity. And that's all about community and connection. So there was a longitudinal study at Harvard, one of the longest running studies in the country, that showed that the determining factor for how well you age and how long you live, how happy, how healthy you are during those years, is connected to the level of community and connection that you have with other people. It's all about the quality of your relationships. So, not the number of relationships, but the quality of that community and connection that you build. And so, there's this new challenge, and I would like to invite you guys to do this. I think, Miranda, how many people do we have on the call?
We have 62.
That's perfect. So it says to build a community of 50 people. And I bet we already have a community of at least a handful of people, right? Our close family, our close friends. So we've got 60 something people on the call today. The homework assignment that they've kind of given in this longevity community that I follow is to have a community of 50 people. And so that's what I'm working on this year. So 50 people that they're closer than acquaintances, but they might not be a best friend, right? And so I'm working on that. I'm kind of keeping a tally, and I'm trying to really work on new connections. So I have a lot of people in my life, but I want to make sure that I'm really cultivating those well, because that is going to be a key indicator of how happy, how healthy, how long I live. And my goal is to live to 101. So I have a lot of work to do if I want to do that. And if we don't have that as a goal to make those 50 friends or to live to 101 or whatever it is, right? We're probably not going to get there, because if we don't realize that that's our goal, we're probably not going to take steps to actually meet that goal. So I want y'all to think about that. How long do you want to live? Um, what does like healthy living look like to you? Meaningful life look like to you? And then do you have 50 or more friends? I don't know. I bet some of you probably do. And then a balanced diet and regular exercise. So, guys, I know that this is sometimes an unpopular opinion, but I don't subscribe to calories in, calories out, move your body, and you're going to be a perfect weight. If we look around, if we look at our own lives, we know that if it was calories in, calories out, and move your body, we would all be a healthy BMI, right? Which is not the gold standard for me and for a lot of people when it comes to healthy weight, right? It's just one of those factors. A lot of other factors play. How well do your clothes fit? How muscular are you? How much muscle mass do you have? How are you tracking your macros? What does your blood work look like? What's your waist circumference? How heavy can you lift? How much weight can you lift comfortably and safely? There's lots of other metrics, but BMI is just easy, right? And it is important. It's important to know that number. And so, eating a balanced diet, I give this example all the time is people who have diverticulitis and have like a stomach issue, a GI issue, they can't eat cruciferous vegetables like broccoli. And when we think about broccoli as being a healthy food, we think, oh, broccoli is healthy. But broccoli isn't healthy. It's actually something that people should avoid if they have that condition. And so instead of thinking about, pizza's bad, broccoli's good, we have to think about what's healthy and what's sustainable for me. Moderation. I say moderation in most things. That's kind of my mantra for healthy eating. And I know that there are just some things that I can't eat. I have an allergy to sulfa. And thanks to ChatGPT, I put in some of my symptoms and I said, if I have an allergy to sulfa, are there other things that I'm likely to be allergic to? And I have a lot of health issues and always have since I was a child. And so I see a lot of doctors, a lot of specialists, a lot of healthcare professionals. And no one has ever told me that if I had an allergy to sulfa, nor did I ever learn in school, but if I have an allergy to sulfa, it's likely that I could have an allergy or sensitivity to shellfish. And so I noticed that when I would eat shrimp, I didn't feel good. And y'all, I love shrimp. But I noticed that I don't feel good after I eat shrimp. And so for 3 weeks, I have not eaten shrimp. Usually I would eat it once a week. I have not eaten shrimp in 3 weeks and I feel dramatically different. Also, my inflammation markers are down. And so it's likely that I do have a sensitivity. There's a protein in shrimp and other shellfish that is the same protein that usually is responsible for calling the sulfa drug allergy. Y'all, I have broken my heart this summer because I really, really love seafood. But I also love feeling good. And so that's something that I've had to say, okay, when I'm at the beach on vacation with my family, I'm probably going to get the coconut shrimp. But I know that it's not something that I need to eat every week now. So that's the example for me of how we can be really balanced in our diet. And then exercise, that's moving our body intentionally. That doesn't have to be a huge hard workout. It doesn't have to be a HIIT workout or an Orange Theory workout. It's walking. It's walking. It's sustained exercise that you can still have a conversation, but you might be a little breathless. You might be talking a little faster. Um, that's really important for our health and not just our physical health, but also our mental health and our brain health. Brain health and mental health really to me are the same. And then routine screenings and preventative measures are encouraged. So, one of our classes, Your Health Over 40, has a lot of those preventative screenings, and Wellbama is an excellent way to get that journey started. My entire health journey started when I was 250 plus pounds. I don't know how much I weighed because I stopped weighing myself. And I had a lot of health issues. My blood pressure was high. I was having stroke level blood pressures, migraines every day. And I signed up for Crimson Couch to 5K and I scheduled my Wellbama screening, which I had been avoiding because I was so embarrassed. I didn't want to step on the scale. And I just decided one day, you know what? I don't want to live like this. I don't want to be on medication forever. So I'm just going to make the appointment and go. And the students were students that I taught. So I was a little embarrassed, but they were so kind. And it was so welcoming. There was no judgment. And that was the beginning of my health journey over 7 years ago. And then safety measures within the home are recommended. So things like for some of the ones that are working with and taking care of elderly folks, so throw rugs. So any kind of rug that could slip or that the edge could fray or peel up. I mean, how many of us have tripped over a rug? I know I do all the time. So taking those up or putting the little corner pads in them, you can get them on Amazon that will attach the corner to the floor. If you have someone that really is at risk for falling, it's recommended that you just take those rugs up altogether because just the little rug edge itself, even if it's not moving, could be enough for someone to fall. Um, Lighting, so making sure that you have good lighting at night. It's not recommended for people when they're younger because having night lights on can alter your nearsighted vision. But for older folks, the risk is more that they're going to fall. So having good lighting on the stairs, having good lighting around the house, making sure that you're not moving furniture. Our bodies can naturally kind of know where furniture is if we've lived in a home for a long time. And if you start moving furniture for people, that can be very disorienting to people. Even if they don't have any cognitive issues, it can be very disorienting because our bodies just kind of know the way. So if you move that piece of furniture, they might have a fall or might have a bruise or bump. So lighting, rugs, not moving furniture, knowing about stairs, are stairs an issue, working around those would be the big things I would think about in terms of safety measures. Avoiding tablecloths. Young children and older folks can have a difficult time with tablecloths too. So they could grab on the tablecloth and something could fall or spill or burn. So that's another one that you could think about as well. Those are the top 4 or 5 that I can say for memory would be important. And then thinking about how the body changes, I told someone last week that we really needed to have a class on how your body changes, just like you do in elementary school when you're about to approach puberty. I said, I think there needs to be a midlife crisis class for this because there's so much that you don't know about your body as it starts to change in midlife. For example, until I needed Invisalign, I didn't realize that when you get to your 30s, a lot of times your teeth will shift. So I didn't have to have braces as a teenager. My teeth were straight. But then I got to my 30s and I noticed that there was a gap forming in my 2 front teeth. And I thought, that hasn't been there. And so I went to the dentist and the orthodontist, and they're like, oh, yeah, that's really common for your teeth to shift in midlife. And I was like, why did no one tell me that? So then there I was in my 30s getting braces. That's amazing, but unexpected. So there are ways that our body is uniquely impacted by aging, and having really open, honest conversations about it is so key because then you're not caught off guard. So your skin changes, your bones and joints and muscles change, your mobility and balance, your body shape, your muscle mass usually starts to decline, and you usually get more fat or adipose tissue. And then hormonal changes. So those hormonal changes don't just affect your what we call your sex hormones, but it also impacts your blood sugar, your carbohydrate metabolism, your cholesterol metabolism, your thyroid function, and anything that alters those sexual hormones can also alter the way that your food and your vitamins and your nutrients are absorbed. And then of course, you can think about those age-related body changes. So, when you look at Maslow's hierarchy of needs and his pyramid, those basic needs are on the pyramid, including our sexual health. And so, dryness, erectile dysfunction, those are things that can also occur. And so we think about, your stereotypical midlife crisis. And I was talking to a neurologist about 5 or 10 years ago. So midlife was not on my brain, but we were having a conversation and he said, so often what looks like a midlife crisis from a mental health standpoint is really just our bodies and our lives changing, and we don't know how to manage it because we weren't prepared for it. And even though I wasn't in the place where that hit home for me, now as I'm getting older, that conversation and the things that we chatted about are really kind of coming back and saying, okay, what he was saying now that I'm in this age and stage of life, that really is resonating or making sense to me. So our skin gets dry, our bones, joints, and muscles, our muscles get smaller, and so that's going to affect our joints. They can get more inflamed. You can have a lot of pain. Um, and then our bones can lose density. So knowing our bone health is really important, especially for women who tend to have osteoporosis at a higher rate. So a DEXA scan, DEXA, is a scan that you can do fairly cheaply. It's just over $100 out of pocket that you can get one of those in Tuscaloosa, and it can look at your bone density. A lot of people do not order those proactively. But more and more men are actually having osteoporosis because their hormones imbalanced. They're having less testosterone. The testosterone over the last 40 years has sharply declined, and they're having more estrogen. So now men are more likely than they ever have before in having osteoporosis. And so I was at a talk about that about 7 months ago, and was really, really interesting hearing a nurse practitioner talk about that, a male nurse practitioner talking about his male population and how he has to be very careful working in orthopedics of making sure he's really screening the male patients a lot for that. And then, of course, we talked about body shape, which usually the hormones in our body shape is what people tend to want to talk about, but that's not going to always be the thing that happens first, right? It's not going to be the thing that you notice first. So our teeth and our gums can change, so it impacts our overall oral health. Our oral health is a good indicator of how healthy we are in general. So our teeth, our mouths, our skin are really good first indicators of how healthy we are. Our hair and nails are very closely second to that. So we're going to be doing a class in the fall about our hair, our skin, our nails, our scalp health. Hair can become thinner and weaker. You can have alopecia and balding spots, even for women and for men, of course. Our nails can become dry and brittle. As we age, we start to get ridging in the nails. So, as my nurse practitioner and my dermatologist, when I went to see them for a skin check last year, I said, I can't wear gel nails like I used to because of the ridging in my nails. Is that a vitamin deficiency, do you think? Or is that something else? And they said, well, unfortunately, you're at the age where you start to get that prominent ridging in your fingernails. And I said, oh, okay. Well, I guess I'll probably will do something else then. And so, now I will say I made some changes to my diet and my nails did get less prominent ridges in them. But apparently that is something we have to look forward to if we're not really mindful. And of course, some people are more susceptible to that than others. Our memory can decline, so may not be as sharp as we used to be. Again, a lot of that is hormonal. When our hormones change, we get a lot of times brain fog. And so there are things like being more mindful about our sleep habits, getting more rest during the day. In terms of breaks, not naps, because naps can really alter our sleep patterns. Using things to trigger our memories, making sure that our nutrients and our vitamins and minerals are at the optimal levels, not just within normal limits. Our immunity can change. It can become weaker because our white blood cells, that those defense mechanisms in our body get less effective. Again, that doesn't have to be our story, but a lot of times it is because we have this buildup of wear and tear and toxins in our body. And so if we can address those, then we can age better. We can age well. Our vision and our hearing can also change. We call that acuity. Those changes actually with hormones as well. So my son has a hearing impairment. He was born with a moderate to severe hearing loss impairment, and it's a cochlear impairment. So the cochlea in our ear. There are different types of hearing loss, but that is his. It's called sensory neural hearing loss. And there are about 4 periods in his life because of his hormones as a male patient. This is different for females, where his hearing could progressively get worse. In teenage years is one of the first. And so when he did have his checkup, they had to do a lot of blood work and they had to do a lot of extra testing to make sure that he wasn't having an age-related, which sounds odd as a teenager, but an age-related hearing loss progression. Vision can do the same thing, especially with the screens that we're using. We're on our phones. We've got blue light. We've got, from our phones, we get blue light exposure. So it's what's making us glow right now. It's on our screens all the time. So using blue light blocking glasses, I should have mine on. They're actually in my cabinet right here. But wearing those for most of the day when you're on a screen can be really helpful. It helps prevent that light change in your eyes that's going to affect your circadian rhythm, and also will help prevent your eyes from getting dry and sore. The rule of thumb is for you to look up every 20 minutes for 20 seconds, 20 feet away. So every 20 minutes for 20 seconds, look 20 feet away. And that will help you with your long distance vision, but also it gives your eye a break from all of the nearsighted work that we're doing. And then taste and smell. Taste and smell can diminish. I did not realize how much this impacted your satiety levels, like when you're eating food and that you get that um, feeling of fullness, how much smell and sight and taste actually play into that. If you've ever eaten something blindfolded, or if you've ever, held your nose and eaten something as a kid, you know that that alters the way that something tastes because we are very, multi-sensory. We like to see, feel, touch, taste our food, right? Use all those senses. So if you have what we call poor smelling or visual acuity, or you have something else going on, that can diminish the flavor of foods. Well, over time, those things diminish. And so you can have loss of appetite simply because you can't taste or smell your food as well as you used to. So you can have weight loss and safety concerns around that. Of course, if your vision changes, if you're not eating as much, you're going to be weaker. So that can cause more accidents and injuries. And then hand dexterity. So I learned last year as I was going through my surgery recovery, working with two physical therapists over 2 6-month periods, and then another 6 months with a personal trainer, that I have always had really low hand dexterity. I have a genetic condition that causes that. And some of my kids have that. Each of my kids has a medical issue, some more severe than others. But one thing that we all share in common is a lack of like low muscle tone and a lack of hand dexterity. And so, working on your biceps and your forearm muscles and strength can really help that. So, I thought it was a hand issue that I needed to work on doing hand exercises, and it was and it wasn't. So, doing things like barbell curls over and under really helped to strengthen my ability to open packages because I was always the person that had to grab my scissors to open something. Having good core body strength in your muscles in your abdomen also help with that. But being able to work on your arm strength is actually what can really help with your hands. Now, there are lots of reasons why that would be different for you. But in general, if people can do those exercises, that's important. There are a couple of YouTube and Instagram influencers that have exercises for older adults. I just sent the video to my mom. It's like a series of 8 exercises that you can do with very light weights, like 1, 2, 3, 4, 5 pound weights. And it's all about maintaining functional exercise and functional movement. And so I've got my kids and my mom and myself doing them to maintain our ability to be able to get up. So doing body weight squats, 10 body weight squats, just meaning you stand up, you just do a squat as low as you can comfortably go and stand up. Doing 10 of those an hour has been shown by research to be more effective than doing a full sustained 30-minute exercise program a day because you're doing movement throughout the day. And then bowel and bladder, of course, constipation, difficulty urinating, frequency, that could be keeping you up at night. All of those issues can start. These are just kind of the first signs. And then our sleep does change. Studies show that as you age, you do actually need less sleep, but people are typically getting poorer quality sleep. They're getting interruptions, and there are a lot of times waking up. I typically hear between 1 and 3 a.m. And not being able to go back to sleep. And so sleep then does really become a huge challenge for some people. So, other common concerns, of course, we know these: cancer, diabetes, dementia, osteoporosis, COPD, that's the chronic obstructive pulmonary disease, the flu, pneumonia, shingles can reactivate. If you've ever had, chicken pox, then in your, really starting in your 40s and 50s, a stress episode can induce shingles. I had a good friend several years ago that said, "Hey, could you come look at my back? It's itching." And she was just a few years older than me. So we were mid 30s. And I looked and I said, "Okay." I said, "Well," I said, "I feel a little bit like I might be losing my mind because this looks like shingles, but you're kind of young for shingles." And she's like, "But I'm really stressed." And I said, "Well, I guess I probably shouldn't have touched that." And she laughed, and I said, "Well, let me know if it ends up being shingles." And when she left work, she texted me and she was like, "It was shingles. You did a good job." And they said it was my stress, but it usually happens around the rib cage, so around kind of under where a bra would be or a sports bra, in that rib cage area at the front and the back, and it looks like a red, very kind of crusty rash. That's usually shingles. And then depression. We can have low mood and mood changes. Depression typically tends to be seen with people who look more back to the past. Anxiety is usually a little bit more of the future oriented people worrying about what's going to happen in the future. But depression happens because as we age, particularly in those like last decades of life, those last 10 or 15 years of life, we go through what Erik Erikson calls integrity versus despair. Am I going to have integrity and feel good about my life and my legacy, or am I going to be in despair about how I live my life? Am I going to live from regret? And that oftentimes can cause depression. Depression can be situational like that, but depression also can be neurotransmitters and a physiological reason for depression. So it's very helpful to figure out if you're depressed, why are you depressed? Is it that you have a neurochemical imbalance, or is it that you're depressed and have low mood because of something that you're processing? Those usually get treated the same way, but to me, it really matters which one you're kind of managing, because medication may not be enough if you also are having situational challenges. You're probably going to need to be doing more proactive things around changing your mindset. So other common concerns, things like housing, transportation, financial well-being, end of life decisions, legal concerns, care, any type of care or community or caregiving, respite care for caregivers. There are services in town that allow for adult, they call it adult daycare or sitter service. Memory loss, of course, people, get understandably concerned about elder abuse, safety issues, like we mentioned earlier, mental health wellness for everyone involved. And then there is this kind of hoarding that can happen, hoarding of things, hoarding of belongings. So these are some common concerns. If these are concerns that you have, you can always reach out to someone who's been through this. I think they can give a really good overview of like, okay, what helped with in terms of the legal concerns. You've been through this with your dad or your mom. That can be really helpful, but sometimes you need a counselor for you or a case manager for them to be able to walk through the individual concerns. So just know that there are resources out in the West Alabama community that help you walk through these things, and you don't always have to pay a fee to be able to get connected. And a lot of it, we have some great resources here on campus as well. So other concerns, we mentioned these earlier, but these are the big themes. So the five big themes are falls, home safety, poverty. That can be huge, especially for women. Women typically, because they live longer, and not just average longer, but they typically live longer than men by, I think, about 17 years was the last stat that I saw. A lot of times the financial planning that women get, if they even get any at all, only prepares them for the lifespan of a man that would live a shorter lifetime. And so they tend to run out of money. Women tend to make less money, but they also tend to run out of money sooner because they didn't plan and prepare the way they would if they had gotten financial advice for their specific life. Health insurance, and then, of course, access to health care. So you can identify resources, you can expand your knowledge, you can develop a care plan, and then, of course, prioritize your own health and well-being and plan for when you reach those years, what do you want life to look like? So leave your loved ones with a plan in place. And the time to make that plan is now, not when you're in the moment, because it gets really, really challenging. So I caregive for my mom through her heart issues, through my grandmother's COPD, and then through my husband's cancer journey over the last 17 years, and then for my own kids. And I can say that nursing is a lot easier than caregiving, because with nursing, you just clock out at the end of the day. It doesn't mean that you don't care, but it's different. You can clock out and know that they're being taken care of and that you've done what you could. In caregiving, there is no clocking out. And so there's a much more of an emotional toll, and psychological well-being plays a huge factor into that. I had a patient's family member ask, how can you be so kind and caring and you just respond so well to this person, their loved one. But it's so hard for me. And I said, because I'm not their family member. I'm going to get to leave at the end of the day and go home to my family, and you're going to still be here. And you love this person, and you remember this person when they were, at their healthiest, when they knew who you were, when they laughed, when they were working, when they were doing all of the things that you've enjoyed, all of those memories. And the person started crying. And I said, I don't have that connection. So I can care without feeling the weight of all of those emotions. And she said, thank you so much. That no one has ever spoken to me like that. And no one has ever made me feel okay about having those strong feelings. Because there is going to be a mix of feelings when you do that. So this is the new section that I kind of added more as resources. So I will go through this pretty quickly because it's going to let you pick and choose what you resonate with and what you would need to know. But this is really what caregiving is all about. It's compassionate care that involves recognizing, understanding, and responding to the emotional, physical, and spiritual needs of others with empathy and presence. So empathy is really putting yourself in that situation, whereas sympathy is just kind of saying that you care. Empathy is more of like putting on the struggles that they have and really truly caring deep down in. It's walking in their shoes. So compassionate and care really involves how we care for our loved ones, but also how we care with them and how we navigate the fear, the love, the hope, the fatigue, and how we care for ourselves. Caregivers tend to have really poor outcomes after the first year of losing the person that they have caregived for, especially if it's a spouse, because they have neglected their own health. Usually they're canceling their own health appointments. There's not enough money for them or resources or time. And so they typically end up having a healthcare crisis within 1 year of caregiving for someone and them dying. They then become the person that needs caregiving, and they may or may not have someone. So it supports healing and strengthens family bonds. It can help reduce anxiety, and overall health outcomes can be improved. And so caregiving is dynamic. It spans the life, and for every person that you caregive for, especially from my personal experience, it's very different. It brings up a different level of emotions. So these are some elements of compassionate care: empathy, active listening, being sensitive to their culture and to their generational differences. That's really, really important. Honoring who they are and what they would want from their lives. So knowing what's important to them versus what's important for us is really important, because the decisions that I would make for myself were very different than the decisions that my mom would want. And I had to actively advocate for her when she was hospitalized recently. And I had to constantly remind myself, okay, this is not about what Abby would want if she were the patient. This is about what my mom would want. And my mom is going to want the least invasive thing, whereas I am going to want everything that you can give me to help me feel better. Just two different personalities, two different generations. Respect for autonomy. So realizing that even as they're being cared for, that they still are a person with their own identity and their own needs. That can be hard. And then presence, being emotionally and physically available. A lot of times we're physically available for people, but emotionally we sometimes make it difficult to remain emotionally open because it's so painful to us. So we might physically be there, but emotionally we might be a little closed off, and that's pretty normal. That's a coping mechanism. Caring for children, listening and validating, creating safe space. Caregiving for my children during their different health issues and scares, it is really, really scary a lot of times, especially the more that can be hard. Using age appropriate language, supporting connection and expression, those are all really key. And getting a child life specialist at the hospital. Children's hospitals are usually really good about having child life specialists. They can help, and they do a lot of therapy through play, and that can be very beneficial for the family dynamic. Parenting in crisis, having comfort measures, communication, really prioritizing your partnership if you have a parent or spouse that you're co-parenting with. Being a team and having a team that you can trust is really important, because a lot of times you will disagree on how the child should be cared for. My husband and I had to navigate that multiple times, and it's really challenging because obviously we both love and care for our child, but we have two very different opinions and points of view of how that child should be cared for. And that can really cause a lot of stress on your relationships. Supporting adolescents and young adults can be very, very difficult. And we have had to do this. We have an adult child, and it can be very difficult to support them while still fostering and honoring their independence, their mental health, your mental health, their trust and privacy, and then your empowerment. Parenting an adult child is very different than parenting a child that's at home and has a level of accountability to you that they don't have once they leave home. Caring for adult loved ones, this can be peer caregiving, so maybe a sibling or a friend. That can be difficult because it can change your dynamic with the person. It can change the friendship. Chronic illness is really difficult. I identify as someone who has a chronic invisible illness, and that can be difficult because we tend to have a really difficult time explaining what the impact of the chronic illness is on our lives, because we have spent so long making it look like we're not having a health issue. And that can become a huge part of your identity. And so recognizing that you're separate from the health challenges that you have is a huge thing that you go through, especially for people like me who had a chronic illness since childhood, where your identity was forming and a huge part of your identity became that you did have a chronic illness. Burnout risk and all of this is very real, and then maintaining your dignity. And really, maintaining the dignity is about the way that you speak to someone, the words you use, the tone you use. It's not treating someone or talking to them like they're a child. It's talking to them like they're a person, even if you don't know that they can hear you. When I was saying goodbye to my grandmother, people would say, "Why are you talking to her? She's non-responsive." And I would say, "Because hearing is the last thing to go, and I want my grandmother to hear me telling her that I love her. I don't want her just hearing the beeps of this ICU." So that's really important. Hearing is the last thing to go. So they can hear you. If they're with you, they can hear you. Compassionate care with, dependency, combating ageism, giving support, grief and closure, also important. You can have anticipatory grief. I think that anticipatory grief tends to lead to complicated grief sometimes. And so having someone to support you, a counselor, a therapist, a coach, a mentor can be very important. And naming that, the anticipatory grief, I'm anticipating this loss and I'm already grieving. And that can go on for a really long time. Shared needs, role reversal, and then continuing to be compassionate. You can get compassion fatigue, even though you love this person, it's really impacting your day-to-day life and they're not able to be in relationship with you in the same way. So you can really, really get burnout and compassion fatigue. And recognizing that in yourself. Do you know what burnout and compassion fatigue looks like? For me, if I have my hair in a ponytail or my eyebrows look unkempt, then you know that Abby Horton needs some compassion and some outreach. So if you ever see me in a ponytail and I'm not doing something physical outside, then if I ever show up to work with a ponytail, please come check on me and ask me if I'm okay, because you won't see me wearing a ponytail. If my eyebrows are a wreck, then I probably am a wreck. And then if I ever say I don't care, well, I just don't care about that. Y'all, I care about everything. So if I say I don't care about something, that's my clue to say, okay, Abby, we got to get a grip. You need to take a break. Like, give yourself a timeout. So those are my three things that I know that I'm going toward burnout, fatigue, that I need to take a break. Put myself in timeout is what I tell my kids. If things are getting too heated at home, I'll say, kids, time out. Mama's putting herself in timeout. I'll be right back. And I did that from the time that they were little kids, so they know. And then at night, because I'm a nurse, I would tell them, okay, kids, unless it's an emergency, I'm clocking out. I mean, obviously, once they were old enough to take care of themselves. So I'd say, okay, mama's clocking out for the night. If you've got an emergency, come. Otherwise, it can wait till the morning. And so really setting those expectations up with the people that you're doing life with can be really helpful. And then system challenges, there's a lot of, in terms of bureaucracy, in terms of legal aspects, you just need to get someone that can help you. There are patient care advocates at hospitals. There are, counselors or social workers or case managers. Utilize your resources. If you don't know what to ask for, just say, hey, what would be typical for someone to get in this situation in terms of resources? Is there someone I can talk to? And then isolation, making sure that you've got those social connections and community. The thing that I learned is that when you're in these situations, that's not the time to build your community of 50. The time is now. So self-care is important. We've got a class on the wellness basics, and so you can go back and look at that at the archived webinars on wellness.ua.edu, the 5 wellness basics: sleep, nutrition, movement, mindset, and hydration. Boundaries are important as well, so I added boundaries here. Support networks, provider collaboration, making sure that there's someone who's really quarterbacking the team. And sometimes that's probably you as the caregiver, but you need someone on the team who's also looking out for your loved one. And then learning and educating yourself about advocacy, and then learning and educating others about it so they can be doing the same, right? The more people who are voicing concerns, the better, because then they know it's not an isolated incident. So, a mother singing to her child after surgery or before surgery, an adult who is trying to juggle, walking through chemotherapy with their spouse. I've walked through multiple radiation treatments with my husband. That is a different way to live your first years of marriage. Geriatric care, an adult child, daughter, son, creating memory aids or rituals for the mother with dementia, dealing with strong emotions but still love. Those are all important. And then really just recognizing that you're in this season of caregiving, and caregiving has to be a season. You can't live your whole life in caregiving mode or you will burn out. So family caregivers really are the invisible backbone of healthcare. You doing what you're doing is so important to everyone. And then a call to action, how can we provide supportive compassion to people who are in this season of life? So, what has caregiving taught you about love, limits, or letting go? Y'all want to pop that in the chat? These are just some resources, talks about the sandwich generation. So people like me who are caregiving for kids and parents, you might want to read that. I think it really speaks to it. It's a playful way of talking about hard things. Caring for the caregiver. So these are just things that you can look over and choose, what would be helpful to you in this season. Find a support group. If you can't find a support group, start a support group. Connect with other caregivers and take time for yourself. Healthy aging is possible. Identify what you're most concerned about today from our talk, and then use the resources we've given and the ones that you find. ChatGPT is an amazing way to get resources. Type in your need and it will give you some really good resources, or even some prompts and things to think about. And then track your progress. So sometimes we think that we're not making progress, but it's because we haven't looked back to see how far we've come. And then how do we live longer, healthier lives? It starts with doing the preventative care now. So schedule your Wellbama appointments, keep coming to classes, keep going and doing all of the fun activities and events on campus, get your annual physical exam and blood work, all the great things that we know to do, right? So some other aging tips: just treat this like a menu. Take what resonates with you and leave the rest. And then go ahead and create your long-term plan. So go and make an appointment through HR to look at your retirement plan and your healthcare costs. They can project all of that. The minute that I got hired, the first semester I worked here, over 14 years ago, I made an appointment with the retirement. I hadn't even gotten really registered in the system good, and I was already talking about retirement, because you got to plan for it now. And then a toolkit for healthy aging. So Blue Zones is a great one. There's books and documentaries and free resources and newsletters on Blue Zones. Holistic health is so important. Your routine appointments, journaling, tracking your progress. Apps, FitOn, Miranda told me about during COVID, and it is my absolute favorite app of all time. If you don't do anything else, download the FitOn app. You can do the free version, and it's great. You're never too old to set another goal or to dream another dream. C.S. Lewis. Please follow us on our social media. And now we can go to the chat. I know we're going to come up on time, but I'll stay so we get all of the questions answered. All right, Miranda's got the slides in the chat and dropped the Strive for 5 challenge. That was my very first challenge that I did after Crimson Couch to 5K. Kelly, it's 2 rows up from your comment on the slides. Christine, very helpful. My mom's health is failing. She didn't take very good care of herself during her younger years, and I want to do better for myself. Yeah, and we just do the best we can as we learn and grow. I don't always do everything perfectly either. Far from it. We just do our very, very best. Yeah, I'm so glad. I hope this was helpful.
Hey, Abby, can you put the app slide back up? You still have your PowerPoint open?
Yeah, I do. Let me go. I think it's just on. There we go. Oh, Laura asked about the nails. So I needed to make sure that I was absorbing all of the nutrients and things I was getting. And so I did some gut health reset, worked on my inflammation, and started supplementing with vitamins. My vitamin D was low, but it can be from a lot of different things. That was just my particular case. It's unfortunate that it doesn't just respond to one thing. So you never know. I'm going to move this over here where I can see you guys. So you never know what it is because of you, but for me, it was my vitamin D.
Could
I'm glad
collagen
you
help with that?
enjoyed it. Collagen could, yeah. Some people respond better to collagen than others. But protein is also another one to make sure your protein is not low. You don't want to overdo protein because it can be hard on your kidneys, but protein, collagen, vitamins, but for me, it was vitamin D. Thank y'all so much. Well, I know it's 1 o'clock, so if you need to go, that's completely fine. But if y'all have questions or comments, please feel free to keep putting them in the chat. Yeah, Sherry says she lived through this with her dad and now her husband's 75. Yeah, Sherry, so you've got some experience. I'm sure it differs with the spouse, but a lot of the same themes come up, I think. That was true for me anyway. Well, I hope this was helpful, guys. If y'all need anything, please let me know. I'm happy to be a resource. Jennifer, thank you. You're so encouraging. Yeah, praying for everybody here that's going through this season of life. Just remember, it is a season of life, and it will be a part of your journey, a part of your story. But it doesn't have to be your whole identity. It doesn't have to be your whole story. And still keep trying to, have joy every day, to take care of yourself every day, and to realize that it is a season. And yeah, it's hard, but it is a season. Taffy, can I just come by for a pep talk? Yeah, sometimes I need them. When I need a pep talk, if I can't give them to myself, Miranda's a good one too. She gives me really good ones. But yeah, Taffy, always. Well, guys, I hope y'all have a great rest of your day. Oh, one more app. I downloaded the Voxer app. Let me type it so y'all can see it. It's a walkie-talkie app, and it is amazing. It is an app that you can just do asynchronous talks with people. And so I have a couple of different groups. So instead of getting on a phone call where we might be busy, I will get on a Voxer and I will send them my voice message, and it makes the walkie-talkie sound. It's really kind of fun. And then they can come back when they have time and respond. So that's a really great way to, cultivate these 50 friendships, to get your community together, is have a Voxer app, and you can do groups or do individuals. And it's a great way to stay in touch with people when you're living a really, really busy life. That's something I've added in the last couple of months, and I really do love it. And I love hearing that little sound because I had a walkie-talkie as a kid. I was a 90s kid, and it was great. So, all right, guys. Well, I could talk forever, but I'm just going to say roll tide and have a great day.
Thank you, Abby.
Bye.
Hope you'll have a great day.